Hi, I'm Clair Francomano, and I'm here to discuss the Ehlers-Danlos Society's program for Centers and Networks of Excellence. I have no disclosures relevant to this presentation. So the Ehlers-Danlos Society has a mission that Laura Bloom has come up with. It's abbreviated CARE, and this stands for, the C is for care, to provide life-changing support services. A is for access, to increase availability of clinical services to people with EDS and HSD, and research to expand our knowledge about EDS and HSD. And then we have an educational mission which is fulfilled through the EDS ECHO program, the Global Learning Conference, and the International Symposia. The goals for the Centers and Networks of Excellence program were to increase the availability of clinical services for EDS and HSD, and to decrease that long time to the diagnostic odyssey to reach a diagnosis, and also to harmonize the communications and care for patients with these disorders. The timeline for developing this program started in spring of 2022 with funding that was received, and in quarters 3 and 4 of 2022 we developed the criteria and the application process. And then in 2023 the first round of applications were submitted and evaluated, and we have now 18 centers and Thank you so much. So, as I was saying, there are now 18 centers and networks that constitute our first cohort of organizations. The requirements for the multidisciplinary centers of excellence were to take a patient-centered approach and to utilize the 2017 diagnostic criteria to provide multidisciplinary care discussions for among the participants, the providers in the practices, and to demonstrate for the providers to demonstrate that they have considerable knowledge and expertise in the care of patients with EDS and HSD. In thinking about the staffing, we asked the centers to have at least 3 providers in different areas of specialties. And for the centers, these are to be all under one administrative umbrella. For the networks, they can be collaborating providers that are in different institutions but who refer among each other and care for the same patients. Administrative staff to help coordinate, because there's quite a bit of coordination involved in the care of these patients, as you all know. And then we also required a genetic counselor or mental health professional to be on staff. And we're asking the centers and networks to provide feedback surveys for their patients so that we can get a really good, honest evaluation that the patients are seen and heard during their visits. Research is an important element of this, and we're encouraging the patients to participate in the EDS Society DICE registry, and for the providers in the centers and networks to contribute to collaborative research. And for the educational mission, we're directing patients to educational materials, and the clinical lead or their designee is going to be participating in an ECHO program that will be specific for the centers and networks of excellence. So in addition to the multidisciplinary centers, we have the option for a multidisciplinary network, as I mentioned, and then there are specialty centers or networks that may specialize in a wide range of different areas that are specific to the care of patients with EDS or HSD. And in addition, there's an option for centers that focus exclusively on research but may not be providing clinical care. So the 18 centers are spread out around the globe, as you can see here. We still have quite a bit of work to do to cover the whole globe. We've got large continents, South America, Africa, and Asia that are not yet addressed. But we have made a start. So we have 10 centers or networks in the US, 2 in Australia, 2 in the United Kingdom, 2 in France, 1 in Germany, and 1 in Italy. And the pathways these 18 care providers have selected, there's 1 research center, 3 multidisciplinary networks, 6 multidisciplinary centers, and 8 that are specialty centers. You know, ECHO is going to play a very important role in the CNE program to promote multidisciplinary learning. We expect the discussion of challenging cases along the all teach, all learn motto of the ECHO program, and the discussion of challenges and best practices for care delivery, sharing opportunities for research participation for providers and patients, and sharing of educational materials for the patients. And we hope in the future, EDS ECHO will provide an opportunity for local multidisciplinary case discussions and regional teaching opportunities to expand access to care locally. And our vision is for a future with expanding care regionally and networking internationally. So my thanks to the Society, to Laura Bloom and Amelia Rinker, who's our ACE coordinator, and to the EDS ECHO program under Dr. Alan Hakim and Paul Gardner. Thank you very much for your attention.